Other at-risk populations include immunocompromised individuals. So we see, of course, people that are immunocompromised, cancers, different autoimmune diseases, that sort of thing. They can pick up things quite easily. So we have to be ultra careful and ultra mindful when we're transporting them and when we're caring for them about using our own personal protection and not spreading things to people. Homelessness and poverty-stricken individuals, that's a whole new thing in itself, you know. Like I said, we're seeing more and more people that are living in cars, living in vans, not because they choose to, but because that's the fate that life has dealt them. We're seeing people that are poverty-stricken, seeing people on the streets. But also with at-risk populations, we need to think about people that we might see in the hospital, such as people that have central lines or even IV access. We have to be really careful about that, make sure that we're using proper hand washing, proper care techniques. People with Foley catheters. A lot of people take Foley catheter care kind of for granted, and they don't really think of it as being as serious as it is, but it's very serious that you don't let the Foley catheter get up above the level of the body and that sort of thing, so that doesn't run back in. All of those things can introduce infection into the body, and that's difficult when you do transportation of individuals. It's very difficult to do because the thing that you want to do, of course, first thing is lay that Foley in their lap or put it between their legs, which is okay as long as you're making sure that it's on the same plane.
Well, and usually we'll have them empty it before the patient, because
make sure that it
makes
gets
it
empty
more
before you transport. That's a good way to prevent. You betcha. Bed-bound patients are at risk, you know, and anybody with open sores. So you want to make sure that you're really, really careful when transporting people with open sores. Anybody that has anything like that, you're going to want to cover with clean sheets and make sure that they're protected from any type of, from you, and you're protected from them.
That's why we put dressings on things, because we don't want to touch it.
Yes, absolutely. That's why we put dressings on things.
So, cover that up.
Anybody have any questions or comments about any of this?
What did you say?
Anybody have any questions or comments?
No.
I mean, I didn't
We were good.
talk for quite as long as I was supposed to, but I kind of ran out of things to say. You guys can break it up.
Discuss among yourselves.
Do you all have any questions up there in Zoom
land?
You text them to me and I'll ask her.
Lottery ticket numbers don't count.
I was showing Granville pictures just a minute ago, several years back, 2017. It looked like chickenpox. They thought it was shingles initially, because shingles happen only on one side of the body, and it was from the waist down. And I developed like blisters and was bleeding. I was telling him I was in a wheelchair for a little while, couldn't walk. They never did find out what it was.
So there is actually a phenomenon in the West.
I think it might have been Guillain-Barré or something like that.
Nay, I went to a rheumatologist, I went to a neurologist, was in EDA, we went to the emergency room. We were transitioning, we were still living over here, but when we worked with children, something was terrible. And, my physician said, you need to go to the emergency room.
Oh my gosh.
Big old,
Blisters.
that's probably that way for about a year.
Oh my gosh.
The only thing that they said was vasculitis, which is, it's not a condition, it's just
Yeah, it's
sign.
yeah.
Yeah.
Well, I know in the last
So basically, she's just
5
telling you
years.
she's weird.
Physically,
yeah.
I mean, blisters.
Most of it's just a psychological thing.
In the last 5 to 8
She's an
years, they
overachiever.
had one of my friends worked in a health food setup in Jonesboro, and one of the things that they seen was there was a particular series of vaccine that came out that was supposed to be for chicken pox that some people were getting, and instead of getting vaccinated for chickenpox, they would come down with shingles after having it, and they were seeing that happen in teenagers. And so they were having to be treated and stuff because they were going straight into having shingles as teenagers. It was like some particular series of vaccine for it that I guess there was something wrong with. And she said there was quite a few people that came through that had that.
Has it all sealed. Thank you.
Very much. We're on break for now. Enjoy your class.